licorice root in order to raise their blood pressure, and some success in that regard for those people who have real low blood pressure. Super green foods. Remember we talked about in the diet, you want to alkali with the vegetables. Super greens, coriella, spirulina, wheatgrass, barley grass, they're alkaline agents. And when you alkali the blood, your immune system is better able to handle whatever invades it and to respond quicker. So, if you're not a good vegetable eater, you better be doing some powdered vegetables that are enzyme-rich, super green foods, things like that to alkali the blood. There's a little-known product called humic acid. There's a couple of different brand names it comes under. But it's extremely antiviral. Whatever the virus is, it can attack it. Some studies on that, you can check it out a little bit more online, but we're kind of limited on time, so I don't have as much detail for you. You can buy that in a good local health food store. It has to be taken on an empty stomach. But humic acid has been researched for AIDS, has been researched for herpes, and other types of viruses as well, too. Anyway, I hope this helps. Next, we're going to be moving on to the fitness portion of our show. Thank you very much. Hi, welcome to the fitness portion of our show, and we're working on our last chakra, the 7th chakra, which is called the crown chakra. Now, when your crown chakra is balanced, your connection to God, to your creator, your source, whatever your religious beliefs be, is intact. You'll have trust, you'll try to help other people, your confidence in yourself is good. There's a real balance because there's almost like an energy that comes from above and shoots down into the body. When you're out of balance, obviously you'll have the opposite. You'll be disconnected and you'll always feel disjointed, like something's missing. So rather than do some yoga moves on this, I have a move that I think is much more effective that gets practiced on me, and I use it on my children. And it's from Shinjin Jitsu. And we have a volunteer in Greg, and he's going to let me demonstrate on him. Now, once somebody does this for you, got to move back just a little. Once somebody does this for you, you will never want them to ever stop again. What you do is you gently grab behind the head, and hopefully this shows out. And there's like a little crevice right behind the cranium, right back here. Hope you can see my fingers moving there. And what you're going to do is you're just going to sit and hold that there for the person. You're going to hold that area. And what sometimes people report is they'll see bright lights, they'll see color variations. All of a sudden, their mind just seems to calm. I usually tell them, if you do this, obviously you want to have a partner, a friend, or a husband, wife, boyfriend, girlfriend, and they can hold it and you can do it for each other. But after a long, hard day where there's a lot of stress, if someone can hold the back of that area for you for a few minutes, they're not going to want, once you have this done, you don't want to let it go because it brings some peace and some connection into you. So give that a try. I hope that helps. And have fun. Next, we'll be moving on to the research portion of our show. Thank you. I know, Greg doesn't want to get Hi, welcome to the research portion of our show, and once again with us is Ralph Turchiano. Ralph?
Thank you for that intro. Well, in regards to ADHD, or what appears to be the epidemic of ADHD, could there be something in the environment spurring it on besides just diagnosing it more? Well, in November 15th, in the issue of Biological Psychiatry, they discovered something quite interesting: plastics. There's a chemical in plastics called phthalates. Don't ask me how to spell it. It's not spelt exactly the way it sounds. They said, quote, they found a significant positive association between phthalate exposure, again, phthalates from plastics, common plastics you find every day, and ADHD, meaning the higher the concentration of phthalate metabolites from plastics in the urine, the worse the ADHD symptoms and test scores. They drew a direct not a correlation, but a causative effect of plastics to ADHD. They said, quote unquote, and this is from Dr. Shou Yang, explained that these data represent the first documented association between phthalate exposure from plastics and ADHD symptoms in school-aged children. The editor of the Biological Psychiatry also commented, the emerging link between phthalates and symptoms of ADHD raises the concern that accidental environmental exposure to phthalates may be contributing to behavioral and cognitive problems in these children. They definitely need more research. What's holding up the research? The Centers for Disease Control, which in 2005 didn't seem they were that interested in any connection between plastics and ADHD at that time. So while they sit on the laurels, it's something for you to think about. Again, this is plastics from drinking bottles, from soda bottles, from plastic forks, spoons, everything you normally see in the environment. This is common plastic, nothing fancy or special. Something to think about. And maybe it would be interesting too if you remove those plastics from the child's diet for a week or two to see if the ADHD symptoms improve. I'd be curious about that. That'd be an interesting study to follow up on. Vitamin A. Remember how they demonized vitamin A? Well, scientists at Newcastle University found out that a lot of women are very deficient in vitamin A. This came from Britain, of course. They said, quote unquote, and this is the reason why, almost 50% of the women have a genetic variation which reduces their ability to produce sufficient amounts of vitamin A from beta-carotene, meaning chances are they need to get their vitamin A from a meat source, fish source, or something along those lines. But regardless of that, even then, they were still only getting 1/3 of the dietary recommended amount of vitamin A in their diet to begin with. They pointed out, this is Dr. Leitz, shows that for many women, the beta-carotene is not an effective substitute for vitamin A, quote unquote. Why is this important? It boosts our immune system and reduces the risk of inflammation, such as those associated with chest infections. What our research shows that many women are simply not getting enough of this vital nutrient because their bodies are unable to convert the beta-carotene to a proactive form of vitamin A. They looked at 62 women, and 29 of them, 47%, were totally deficient in it. Again, even when they looked at their entire diet, they were only getting 1/3 of the recommended daily amount of vitamin A to begin with. So you have two choices. Either you grab yourself a good, decent multivitamin, not be so scared of the vitamin A, or you look at your food labels. I'd probably just do the multivitamin a little easier, a lot safer. Aspirin, Tylenol. A lot of you guys take aspirin on a daily basis. Well, recently an article came out from the University of Missouri that basically discovered that aspirin and Tylenol somehow stunt the effect of vaccines. Meaning, when you take aspirin and Tylenol, your body is not producing an antibody response to these vaccines the way it should be. Meaning, if you get a vaccine from swine flu, whatever it is, flu vaccine, pneumonia vaccine, it just doesn't seem to work as well, especially for those of you who take those two medications on a daily basis. What did they discover they did? They discovered this, and quote unquote, these drugs block the enzyme COX-1. Remember a long time ago in Celebrex and Vioxx, you heard about COX-1, COX-2 inhibitors? They block the enzyme COX-1, which works in the tissues throughout the body. We have found that if you block COX-1, you might be decreasing the amount of your antibodies is producing, and you need high amounts of antibodies to be protected. They also admitted they really don't know all the side effects, long-term or short-term, to the aspirin or the Tylenol. They also said this too, that the Missouri researchers said, the study and the regulation of inflammation and how that leads to the development and prevention of diseases. Many diseases, such as arthritis, cardiovascular disease, and diabetes, are all chronic inflammatory diseases. Now here's the catch. Listen very closely. Again, this is in regards to aspirin and Tylenol. Contrary to previous belief, inflammation is generally a good thing that helps protect people from infection. Many of the non-steroidal drugs that treat inflammatory conditions reduce antibody responses, which are necessary for treating infections. Now that's the irony. You take aspirin and Tylenol because you think you're trying to keep yourself healthy, you get yourself a couple of vaccines or whatever it is, and not do much of anything. In fact, that aspirin on a daily basis you're taking for general health, you may have to reconsider over time. Because if this article is correct from the University of Missouri, then basically that means you're more prone to get sick compared to a person who's staying away from those anti-inflammatory medications. If you don't need to take it, then why do it? Think about it. Aspirin is not a vitamin, it's not a nutrient. It breaks something to fix something. A miracle drug? Yes. Made to be taken on a daily basis like a vitamin? I would rethink that. Now we go to chicken. Now, I always like for looking for good alternatives to basically prescription drugs. And this prescription drug alternative is methotrexate. Methotrexate is often used as one of the only few tools they have to treat rheumatoid arthritis. Well, in the Biomed Central Open Access Journal to Arthritis Research and Therapy, there's tons of good studies out there. They just don't make the news. A lot of doctors are working really hard. Patients who received a 12-week course of chicken collagen II capsules showed significantly improved joint function with fewer and mild adverse effects than those taking methotrexate. In fact, the researchers this was a randomized controlled study also. Indeed, the researchers said, quote unquote, indeed our work confirms that treatment with oral chicken collagen II leads to the improvement in arthritis with no significant side effects. So before you grab that bottle of methotrexate, why don't you try a simple bottle of chicken collagen II and see how that works. Yeah, so much for alternative therapies in that one. Physical activity. Seems like every time you open up the newspaper, there's something trying to discourage you from exercising for whatever reason. Well, they finally came conclusively that physical activity does extend lifespan. They looked at athletes, and this is reported in the Circulation Journal of American Heart Association. They found out that people who are physically active with intense exercise, not just guarded, but intense exercise, tend to have what's called longer telomeres. And what happens with the telomeres, if I'm pronouncing it right, the longer they are, basically the more cells can replicate, the longer you live. The shorter they become, it's kind of like a fuse, the less likely your body's to be able to produce new cells. The more exercise you have, the greater the telomerase enzyme you produce, which seems to protect these telomeres. And they said, quote unquote, this is direct evidence of an anti-aging effect of physical exercise. Physical exercise can prevent the aging of the cardiovascular system, reflecting this molecular principle. The fitness level of the athletes were superior to untrained individuals. The athletes had a slower resting heart rate, lower blood pressure, body mass index, and a more favorable cholesterol profile. Long-term exercise training activates telomerase and reduces that telomere shortening in human leukocytes. The age-dependent telomere loss was lower in master athletes who had performed endurance exercise training for at least several decades. Next time you open up that paper and they're trying to say exercise doesn't make a difference, why don't they actually start looking at research instead of hearsay? Now, how many of you think that GERD is caused by stomach acid? Well, this came out of the UT Southwestern Medical Center research. They discovered this, that quote unquote, rather, gastroesophageal reflux spurs the esophageal cells to release chemicals called cytokines, which attract inflammatory cells to the esophagus. It is those inflammatory cells drawn to the esophagus by cytokines that cause the esophageal damage characteristic of GERD. This condition is manifested by symptoms such as heartburn and chest pain. They said, quote unquote, it didn't make sense that acid caused ulceration of the esophagus. And this is what they said. That doesn't make sense if GERD is really a result of an acid burn, as we're all taught in medical school. I'll continue this article next time. And thank you.
Thank you very much, Ralph. Very good information. Once again, do your research. Thank you for joining our show. Bye.